Welcome again, everyone, to today's episode of Resilient Health Radio. I'm your host, Dr. Darin Ingels, and my guest today on the show is Dr. Ruchi Gupta. She is a board certified pediatrician and health researcher, the founding director at the Center for Food Allergy and Asthma Research at Northwestern University in Evanston, Illinois, or Chicago, Illinois,
Yeah.
and is also the author of the book Food Without Fear, which I want to talk about with her today, and really an expert on food allergies in children. So, Dr. Gupta, welcome to the show.
Well, thank you so much. I appreciate being here.
So, I had the distinct pleasure of hearing you speak at a recent A4M event in Boston just a few weeks ago. And again, I was so, I guess, really refreshing for my ears to hear someone finally really talking about food allergies and the differences between food allergies and sensitivities and intolerances. And I know this word food allergy just gets thrown around kind of willy-nilly. Maybe we can start by just kind of breaking down. Can you talk about really the differences between food allergies, food sensitivities, food intolerances?
Yes, absolutely. And I appreciate you starting there because when a reaction happens, when you eat a food and something happens in your body, you don't really know what to call it. And a lot of times people just refer to it as a food allergy. But why it's so important that you know the difference is we now have things we can do for different conditions. So you don't have to avoid that food for the rest of your life. So a food allergy, it's actually an immune mediated reaction, right? So it's an IgE immune mediated reaction that happens in your body where it releases all these, you know, neurotransmit like different things like histamine. I know I don't want to get too sciencey, but like
Yeah.
it does release these chemicals that cause these reactions in your body. And what's so unique about food allergy is it can cause symptoms in any organ system. So,
Right.
we talk about hives and itching and swelling, but then you have like oral symptoms, itching in your mouth, and then throat tightness. You can even have lung symptoms, right? So, tightening in the chest or trouble breathing, GI, vomiting, and you can even have a drop in blood pressure and a very quick decline, which we call anaphylaxis, and it can be life threatening. So, this is why it's so important to know if you have a true immune mediated food allergy. Now, intolerances are also very difficult to live with, but what they are usually imbalance in terms of whatever enzyme is breaking down that food. So, a lot of the symptoms are very GI, like cramping and bloating and diarrhea, vomiting, and just pain, right? And discomfort. You can also get, uh, headaches and fogginess and other symptoms from that too, but they don't tend to be life threatening. And then there's other things. There's something called oral allergy syndrome, which
Yeah.
is very oral symptoms, but so many people have this to fruits, vegetables, pretty much any food now. But it's itchiness in your mouth, rash around your mouth, maybe some throat symptoms. But what you're really uh, doing is you're reacting to the pollen in the food and not the actual food protein. So there's multiple conditions that can be caused by food that are very, very important to differentiate as a patient because you want to know what you need to do for each individual condition.
Yeah, and I might add, what we call food sensitivities,
Yeah.
which seems to be a bit more nebulous in terms of the immune mechanisms, but some sort of delayed hypersensitivity to foods that may not happen like a true food allergy within, minutes or hours, but maybe
Yeah.
it's hours to days after the fact. Um,
Absolutely. Exactly. Hours to days. And then, there's other things. If you really go into it, there's alpha gal,
yep.
right? Which also can be a delayed, but it's to meat. So, this tick-borne or, tick-induced condition, the Lone Star tick.
Yeah.
And then all of a sudden you used to eat meat regularly and now you have this terrible reaction to it immediately, or it can be, later, 12 hours later. So we're learning so much more about different conditions caused by foods. FPIES is another one, right? That infants often
Yeah.
get where it's like profuse vomiting and lethargy. And it's so scary to see that happen. So Really, really understanding what is happening in your body and diagnosing it appropriately to be able to manage and treat it.
Well, I'm glad we started off the conversation this way because, well, we have so many patients who go, particularly they go to an allergist, they get skin prick testing or blood testing. It's not IgE. They kind of get dismissed that, well, whatever you're experiencing, well, it's not allergy. Okay,
Yes,
well, by definition, no. But again, maybe it's an intolerance, maybe it's a sensitive, maybe
yes,
it's a different type of reaction to food that's not an IgE mediated reaction. But
yes.
it doesn't dismiss the fact that you're having some bad reaction, to a food substance.
Exactly. Yes, and figuring out what it is and who can help you. You do a great job, obviously, and it is so important to be able to find the right provider who can help you differentiate what symptoms you're having and what diagnosis you have. GI doctors, diagnose a lot of the EOE. We didn't even talk about that,
Yeah.
eosinophilic esophagitis, where it's more in your esophagus, so you get more choking and trouble eating the food, and then you can, have weight loss and other symptoms, celiac. So like as we go into this, we could spend the whole,
I know it's a lot.
yeah, it's a lot,
Yeah,
but
I guess the
figuring it
take
out.
home message is that there's a lot of ways your body
Yes,
can react to different food substances. They're not all the same and they're not equal. And the
right.
degree to which it affects you can be, like I said, it could be severe and life-threatening,
Yeah.
or it could be a nuisance, kind of irritating kind of symptom.
Yes, that's it.
So, what are you seeing, in your research about, again, we were talking before we got on camera, it's like, I moved every 2 years as a kid. I lived all over the country. I didn't know a single kid ever that had like a true food allergy. It seems like
Yeah.
over the past several decades, we've got this massive increase, peanut allergies become really quite
Yes.
common, other nut allergies, and of course, eggs and milk and wheat and some of the common food allergies, they seem to be increasing. What is really disposing, young people to these allergies that we didn't see a few decades ago?
Yeah, and that is the billion-dollar question these days because we all know this. Like growing up, no one had a food allergy in school. Everyone took PB&J. I actually have this comic on my wall in my office, and the first part of it is adult talking to a kid saying, in my day, there were no food allergies. And that's what we hear all the time. That's what you're
Yes.
saying. And that's what we all experienced. And then the second part of the frame is our goal, which is that kid grows up and is talking to another kid and is saying, in my day, there were food allergies. And wouldn't that be the dream, of our careers, to be able to solve this mystery of why we saw this increase so fast? And, because it happens so quickly, we know genetics plays a role, but it's not genetics because it doesn't change so fast. So, what is it in the
Right.
environment? And that's what we're all searching for. So, a couple of the theories, and there's this 5Ds, right? So, dirt, we always talk about playing in the dirt and our
Yeah.
kids not getting outside and playing in that dirt. And we're too clean, right? That whole hypothesis of are we using too many antibacterials? Are we not outside and being exposed to things early? So your body starts fighting things that it shouldn't fight. And so that's one. We, I think, talked a lot about, and then there's dogs and dribble. And
Yeah.
so, having pets and animals around, we know helps, right? It influences that microbiome. I think it all comes down to that microbiome, that beautiful trillions of bacteria, fungi, viruses that live in your gut, live all over your skin, that are really uh, determining our health to a large extent. So, what are some hits to that? So, antibiotics, like things that we take more than we used to, antibacterials that we use that may kill good bacteria or bad bacteria, but they also kill the good bacteria. Another big piece is diet. That's one of the D's, right? So, what has changed in our diet in a generation? How are we eating? What are we eating? What kind of pesticides and preservatives and like I always joke I think about like one of our first studies that came out about food allergy that made it on a late night talk show, and he said 8% of kids have food allergy. This was a study today. A good thing that most of what our kids eat is not technically food. So, like, what are we putting in our bodies and our kids' bodies?
Yeah.
What is the store-bought stuff with what's in it, and how is that impacting that microbiome? So many, many factors. I don't think it's just one. It's definitely multifactorial. But if we can start to identify, what are we putting in our bodies? What are we putting on our skin? What are we exposing ourselves to? And how do we now make that, go back on the pendulum a little bit farther and make it more natural and more holistic and more healthy as a generation ago?
Yeah, one of the things you talked about in your lecture, which I remember reading studies years ago, when you do like animal studies, if you want to sensitize the rat or the mouse,
Yeah,
whatever, you break the skin and you introduce the antigen or the allergen through the skin.
yeah,
How important, I mean, is the skin barrier
yeah.
as a potential sensitizing agent for these different food allergies?
Yeah, so this is something we're learning more and more about every day. And I'll tell you my personal story. My daughter actually has food allergies, and she was born with severe eczema, severe cradle cap, and eczema and cradle cap are very common, right?
Yeah.
Like 10% babies almost have at least a mild version of these. And so, what we don't understand is how broken skin can impact allergies, but we're learning more. And so, the little poem we have is through the skin, allergies begin, through the diet, they stay quiet. So what this means and what we're learning, it's is that if those allergens are exposed to that broken skin early in life, or really now we're learning even in adults, um, there are immune cells right below your skin, and they're ready. And so if they see a peanut protein coming through before your gut has recognized it as safe, they could go on attack. And what that means is then recognize that peanut protein as an invader and not as a friend. And every time it's exposed, then you go down this immune pathway to food allergies, where then when you're exposed and when your body sees that protein again, think it's an invader and go on attack. And so that is one really important thing we're learning about protecting that skin early in life, and using a good barrier, making sure it's safe. And this happened to me. I mean, my own daughter had terrible eczema, and one of the healthiest snacks we thought, which is a healthy snack, but not while you're sitting and holding your baby, and it falling on their broken skin. And so important for parents of newborns to know, like, so critical to make sure that skin is intact early in life, because it could influence that whole, what we call the atopic march,
Yeah.
which is eczema going into food allergies, environmental allergies, and asthma. And you don't have to have all of them, but you have a higher chance of having each one. And what we're trying to study now is if we can stop that eczema, can we stop that whole progression? Yeah.
Yeah. Well, I know it's interesting too. You think about playing in dirt. Of course, I'm a boy, as a kid, my brother and I were always out in the dirt, come back grubby. But it's true. It's like, so much of what's found in soil, at least to a part contributes to our normal microbiome.
Yeah.
And I mean, again, historically, this has been true around all cultures that, we pull food right out of the dirt. We don't clean it the way that we typically do in the United States. So inevitably, you would get a lot of dirt through your normal diet. And I think we've become so hyper obsessed with, we'll call it clean food that you see the lettuce triple washed and, everything's super clean and we irradiate food and we do all these things to try and prevent infection. But at the end of the day, it may be a little bit of a disservice.
Right.
Again, I know at least when you look at cultures around the world where parasites are still quite prevalent, their rate of allergy, asthma, autoimmune disease is incredibly low.
Yeah.
So it seems that these parasites have some beneficial effects that may actually help modulate the immune system and protect against these various allergies.
Yeah. And, those parasites have been studied, right? What does it do? And we haven't had any real conclusive stuff, but you're 100% right. And that's why we started studying it is we don't see these in certain populations. So could it be the parasites? Not encouraging everyone to go get a parasite, but but what else is it? One of the big things that I talk about a lot is how much we've medicalized babies and what
Yeah.
they eat and how they eat. The other big thing in a lot of these places is they just eat whatever the parents are eating, right? Whatever's on the kitchen table. It's not like you have special
Right.
one food, clean
Yeah.
baby food, like with preservatives in your fridge that you have to finish, or the like little squeezy things that so many parents use now. Like what's in that, right? They just eat whatever combination of foods, and their gut gets this hit of so many different flavors, so many different types of foods, and it's just so good for babies. Babies are resilient, and we are medicalizing them, and this one food at a time is limiting the diversity in their diet. So, what I would say is don't medicalize. Start foods how you want, what you want to start, get as much diversity in that baby's diet. Yeah. And like you said, like let them play, let them crawl, we don't need to clean them constantly. Now, we have to be careful, but it's a balance. I think we've swung the pendulum too far, and we need to get back to a healthy microbiome. And many studies have shown that, like just even there was a study of little binkies, and,
Yeah.
we always talk about the firstborn, you like sterilize it, the
Yeah.
second born, yeah, yeah, we'll rinse it. And the third born, you stick it back in their mouth.
Yeah.
So,
I was going to say that it's like I see, the binky fall out and the parent freaks out and they want to go wash it off and clean it really well. I'm like, no, you just pop it back in their mouth. It's like, I think people also don't really understand, again, how kids get sick. Your digestive tract with your stomach acid and the
mhm,
digestive juices kills a lot of stuff. That's
mhm,
actually not an easy way to get a lot of infection, especially from a
exactly.
binky that fell on the floor for 10 seconds and probably didn't get exposed to anything significant anyway.
Yeah. Didn't we have like a 5-second rule? Wasn't that a
We
thing?
always had the 5 second rule. In our house, I think it was a 10-second
Yeah.
rule, but yeah,
One minute. Yeah.
yeah, this idea that everything has to be so, again, hyper sterile, again, it seems to be working against us.
Yeah.
And you start talking a little bit about introducing foods. And again, I remember earlier in my medical career, the mantra was that don't give them all these high allergy foods. The first year of life, it's going to create food allergy. And I think the research has pretty much swung the pendulum the other way and showing that has actually been a disservice to kids, right?
Yeah, and I think that is one of the most interesting parts of medicine is we don't always know. And when we said no peanuts till age 3, that we continued with really until the LEAP study 2015, we did it probably out of extra caution and fear because food allergies were rising, and you would see these news reports of kids dying, and everyone got very scared. In 2000, that a recommendation was made by the AAP to wait to introduce peanut products
Yeah.
and egg till 2. So a lot of these very common allergenic foods, the top 9, we say peanuts, tree nuts, eggs, milk, shellfish, finfish, soy, wheat, and sesame. Those are the most common food allergens, but you can be allergic to anything. However, when we saw this rise, that happened through the American Academy of Pediatrics. And then the LEAP study was done. And I talk about this because I find it so fascinating. The reason we reversed this is a group in London, they were observant, and they were just observing kids in London versus kids in Israel who were genetically the same but had significantly different rates of food allergy,
Mm.
almost 2% to less than 1%. And what they noticed was that these kids were eating a peanut cookie when they were babies. It's called Bamba. And
Um,
because of that, they were wondering, well, maybe this exposure is protecting them in some way. So they did a large study. It's called the LEAP trial and published it. And they took high risk babies, so those with severe eczema, as we talked about. The skin is so important, and randomized them, and half of them ate peanut products and half of them did not. And in the ones that did, it actually reduced the incidence of peanut allergy by 80%.
Wow.
80% is a crazy big number. So immediately that was published in the New England Journal. And then after that, the US, we reversed our guidelines to say no, 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 introduce peanut products early. So this is where I come back to early feeding. Introduce all these allergenic foods if they fit your diet, right? Introduce peanut products. We usually say peanut butter, soft peanut butter mixed with breast milk, formula, applesauce, water, whatever you want, just to thin
Yeah.
it out and start getting it in your baby. And then the other big important piece is don't just introduce it once, but you got to keep it in their diet.
Yeah.
So, keep it 2 to 3 times a week, make it part of their normal menu of the week, and then introduce the others: egg, yogurt. Yogurt's so good for the gut, and you're introducing the milk, and then introduce, soy and wheat. And, if your family eats shellfish, finfish, get that in, So don't hesitate or fear it. The other thing we know is that when infants react, their reactions are usually milder. It's usually rashes or hives or vomiting. So it's not, the significant drop in blood pressure and fainting and anaphylaxis that we see in older kids.
So if that does happen, is it worth to continue to give the child the food? Will they eventually kind of overcome that? Because I know so many parents, they
Yeah.
see that rash around the mouth and they go, oh my gosh, I have an allergic reaction. And now they don't want to give it again.
So, what's really important, if it's just a rash, we often say put a barrier cream around the mouth and
Okay.
then feed the food. Because we've seen way too many kids stop because of a rash around the mouth.
Yeah.
And then all of a sudden they're allergic. They don't put it in their diet and they develop a full blown food allergy. The other thing that we were talking about right before is what we're learning is if infants do develop a food allergy in that those early 6 months to a year, even 2 years early in life, your immune system is pretty resilient. And what we've been seeing all around the world is if you can get on therapy, and we call it oral immunotherapy, where you're eating small amounts of the food and
Yeah.
increasing it over time, or sublingual, same idea, but under the tongue, um, then there is a higher chance of actually reversing it and developing natural tolerance, or what we say growing out of it. So it is important if your child has a food allergy. We do have treatments now. And all of these treatments can be used at any age. My daughter is now, with her food allergy, is 19, and she's starting on a couple of these therapies herself. So um, it is a new world, I think, in this space because we do have treatments, but the earlier you start, the better.
Yeah. Can you talk a little bit about for, kids who already have these allergies and the parents
Yeah.
like, again, they were told by their allergist, don't eat the food again. Here's your EpiPen. Keep it on hand everywhere you go. And most like clinics I'm aware of don't really offer any type of immune therapy. So can you just kind of
Yeah.
walk us through what are some of those immunotherapy options?
Yeah, and this is what's really cool. I've been in this field since before my daughter, so over 20 years, and we have seen so much advancement. So for people with food allergies, there are treatments, and you should consider it and discuss it, with your doctor. But a couple of them are these immunotherapies, which again, small amounts and you increase it over time. So you can do this orally with the food. You start at a very low dose and then you increase it, and then you keep increasing it till you get to being able to handle even, like, say, one peanut, 300
Yeah.
milligrams. Um, and you can do this for any food. Slit sublingual immunotherapy, same thing, like I mentioned, under the tongue. There is another treatment. It's epicutaneous immunotherapy, so it's a patch. That it hasn't come out yet. We've been waiting for it, but hopefully that'll be out in the next year or so. So that's an option. The other big one that got approved by the FDA this year is a biologic. It's an anti-IgE. So we keep saying IgE mediated
Yeah.
food allergies. So it's an anti-IgE. It's omalizumab. And so that is a shot, but
Yeah.
you take it once a month or twice a month, depending on, your IgE numbers and your weight. But it is what it does is it's food agnostic. So it increases your threshold to all foods because it's an anti-IgE. So if you have
Yeah.
multiple food allergies, this is a good option. It also will help you if you have your environmental allergies, right? Because it's an anti-IgE.
Right.
Um, other uh, other neat new things is, you mentioned EpiPen. Well, EpiPen is one epinephrine auto-injector, and now we
Yeah.
have multiple. For so long, that was the only one. That's why
Right.
it's like Kleenex, right? It's
Yeah.
like, so that is one. And then there are generics, but there is another auto-injector that talks to you. It's smaller. And then we now have our first nasal epinephrine.
Yeah, I've
So
heard you mention that at the talk.
yeah.
I mean, that to me sounds very exciting just for the delivery, the ease.
Yeah.
It's small. Uh, so for someone who needs it, and it makes a lot of sense too, going to get in very, very quickly.
Exactly. So if you have a child who has any needle fear, this is a brand new kind of game changer in
Is
terms
it
of,
available now?
yeah, it's
It is.
available now.
Okay.
Yes. So definitely look into that. And then, in I think spring of next year, they're coming out with a sublingual
Oh,
epinephrine. So this tiny little thing you put under your tongue, and that's it. So that's exciting. I can tell you it's changed a lot of my patients' quality of life because they're not as nervous about using it, when they're having a reaction, and the symptoms subside so much faster. So I think those are a couple of the cool advances. But for your babies or for your young children, I encourage it for any age, of course, because it increases your quality of life if you know that you're not going to have a terrible reaction by just accidentally eating the food. But for those babies, I really do think we can reverse it. And even in some older kids too. So yes.
yeah. Well, it's exciting to hear that there's folks like you on the front lines doing the research to figure out this kind of complicated mess of different food reactions. But
Yeah.
there's so many new options in treating it. Sublingual immunotherapy is near and dear to my heart. I mean, I've been doing it in my practice for 25 years. It's
Awesome.
interesting that a lot of the world uses this as their primary allergy treatment. They'll do it before they do allergy injections.
Yeah.
And yet here in the US, the FDA still is kind of hands off. And I remember reading a position paper for the American Academy of Asthma, Allergy, and Immunology. I think it was from 2003. And I think
Mhm.
the summary was when you look at the difference in doses across all the studies, it was like a 40,000-fold difference between the highest dose and lowest dose. So the comment is like, hey, we don't know what dose to give people.
Yeah.
But what's interesting is it all worked.
Yeah.
Like
It
maybe
does.
the dose isn't as critical as we might think, but it's just it's interesting. But again, there is over 1,000 studies on sublingual
Yeah.
immunotherapy. It's actually very well researched, even in children. It's
Yeah.
very safe. I
Mm.
still think, caution with true anaphylactic food allergies needs to be exerted. I was saying I don't do it in my practice because I'm not a board certified allergist, and I think there's some legal liability there. But for food sensitivities and those things, it works incredibly well and pretty quick.
Yes.
I know in our practice, we can get people from beginning to end for food sensitivities in 7 to 8 months. So
Wow.
it's pretty fast. And
That's
again,
incredible.
I've never had a bad, some people, again, we are giving the thing that you're sensitive to. So there are a few little GI hiccups and things like that that are pretty minor. But
Yeah.
again, again, a lot of great tools. But the oral immunotherapy for the true anaphylactic food allergies, I've sent patients to a local clinic and I've seen it help, get their allergy under control.
Absolutely. I'm so glad you're doing sublingual because I totally agree. And the other advantage with sublingual is you can do a mix, right, of
Yep.
all of your foods or all of your
Yeah.
environmental. And so it's not like oral where you're taking one at a time and working
Right.
your way up. So I agree with you. And, that is a big thing is less side effects because it's usually local or GI, but
Yeah.
not, you're not going to necessarily like have that severe allergic reaction happen with sublingual because the doses are so small. So yeah,
Yeah.
I'm so glad. That's awesome that you're doing that.
I also want to talk a little bit about. I know that I think you're the developer, but you've worked with the company YOBI on
Yeah.
some natural care products. So again, we're talking about the importance of skin health, and
Yeah.
I talk to my patients all the time about personal care products because there's a lot of chemicals in shampoos and conditioners and soaps. Again, if we're talking about the integrity of the skin, how many of these chemicals are in some way breaking down the skin barrier, become potentially sensitizing agents? I don't know the answer to that, but it's enough that I think it's of concern. And just for other health reasons, I think it's better to have cleaner products. So, can you
Oh,
tell
yeah.
us a little bit about Yobi and what makes this line a little bit different?
Absolutely. And thank you. So I am a professor at Northwestern and I run a center of research. And then I have this daughter who has severe eczema in cradle cap. And I am smothering her with steroids from head to toe. And I am going crazy because it's terrible. You have a couple week old baby and you're pouring steroids on him. And I knew enough to know that's not good for them, her and any baby. And so it was very eye opening. And so I got together with my dermatologist, allergist, microbiologist to say, we can't do this. We got to find something better. And so she became a bit of a guinea pig and tried a number of different concoctions that we would make up. And we finally came up with what we call YOBI today. And YOBI is a blend of natural ingredients. So it's probiotics. Back then, she's 19. So back then, we didn't know about the microbiome. Now we do. We
Yeah.
understand it. And it's not only in your gut, it's all over your outer layer, this protective layer, we call it. And so probiotics, things like honey, turmeric, B12, like really, really healthy ingredients that feed your scalp and feed your skin and put nutrients back in. Because you're 100% right. When we think of our skin, I mean, think of all the sales techniques, right? For your face, we probably do the most for our face.
Right.
But it's usually like a 8-step regimen people are trying to sell you, where you're cleansing and toning and I don't
Yeah.
know, seruming and what are we doing? Why are we putting all those different chemicals all over us? And what is that actually doing to the microbiome? Our bodies we ignore unless we get dry usually, or and then our scalps we totally ignore. We put shampoo with sulfates and parabens and stripping our good microbiome. And then we wonder why we have hair loss or hair falling later in life. If we don't protect our follicles with healthy nutrients, how are we going to expect healthy hair? So what we did, and then, we're blow drying, we're putting gel in all kinds of stuff because we don't really think, we're not looking at our scalps.
Yeah.
So our goal with Yobi, so basically when we developed it and it worked so well on my daughter, it got rid of all her symptoms, we started giving it away in our clinics. So gave it away for 10 years and then finally brought it to the world after we saw such clinical improvement. So now, yeah, so it's Yobi, yobicare.com, and we have a shampoo, conditioner, a scalp mask, which again is 50% honey. So it's just putting nutrients back into your scalp, and a skin cream. And we're coming out with a body oil. So, and it's for, again, you think of women's products and men's products. We're trying to make a product that you can use on your newborn baby, you can
Yeah.
use on men, women, children, immunocompromised. It's safe and effective. And so that's our mission with Yobi, is to bring healthier, safer products that really help feed your healthy microbiome on your skin and scalp. So yeah,
Yeah. No, I,
that's
I was looking at the website earlier, and again, I was looking at the products. You got a shampoo, a conditioner, some other, products that again,
yeah,
very clean, natural. You got turmeric, you got B12, you got other nice things in it. So yeah, I'm gonna have to try
yeah,
it for myself. But it
yeah. You should. Oh
looks.
my God, yes.
I know I always
And
get a
it's
very dry scalp, and especially now, kind of going into winter
Oh,
time.
yes.
Um,
Scalp mask. Use the scalp mask. It's just mix it with water, massage it in, rinse it out. Don't use anything else. Let your scalp rest and let it
yeah.
like feed on the good nutrients. But it's a great holiday gift for anyone. So
Oh, and I
it's a
also
good time.
appreciate very reasonably priced. I mean, I think if you get the bundle of the shampoo and conditioner, it's like under $20 each.
Yeah.
This is you're going to spend more getting your regular stuff at CVS or Target.
Yes.
So again,
Yeah.
replace the bad stuff with the good stuff. That's always a good idea.
That is all we want. I mean, this is what we're learning, and this is what our whole conversation is about, like putting good stuff in your gut, putting good stuff on your skin and scalp, really taking back your health and like all the stuff we've done to make our lives easier maybe, or like grow more with
Yeah,
preservatives or pesticides. And we gotta rewind and really look at what kind of chemicals we're putting in our body and on our skin, and really take that back. And I think it will improve our overall health, right? The gut, brain, skin, everything is connected. And
absolutely. Well, guys, the book that I have here, it's Food Without Fear, and just a great read, easy understanding, why people have food allergies, what you can do about it, because in much more detail what we talked about today. And you have another book there that I know you wrote with our
oh
friend
yeah.
Lisa Song.
Yes, Alyssa, amazing.
Yeah,
It's
baby
baby
skin
skin
health.
health, and this really goes through, as we were talking about the newborns, what you can do for their skin and their gut. Alyssa added the gut, and then I added a lot about how to feed your baby, in those early days. So if you have someone in your life with a newborn, it's definitely a good quick read.
Well, we will put links to both books in the show notes, and we'll also put a link for YOBI in there for people who want to check out the products. And
Yeah,
then I want to put a link to your research center if people are
yeah,
interested in donating or just want to learn more. They want to
yeah.
connect with your research center. I know you guys have published a lot, so it'd be
We have.
great for kind of stay on top of this again, very evolving field.
Absolutely. And we have tons of free resources on our website. It's cfar.northwestern.edu, but like lots of great resources for people living with food allergies. So yeah, please check it out and share all those resources with your friends and families.
All right. Well, I really appreciate you spending time with me today. And I know people who've tuned in again really learned a lot from talking about this very, again, kind of complicated yet prevalent field. So, again, I just appreciate you spending time with me today, Dr. Gupta.
Oh, well, I appreciate you having me and thank you so much. And anyone, please feel free to reach out because this is our mission, right? We're here to help support real people, going through this stuff. So thank you.
All right. Thanks so much.